What makes a regenerative medicine expert? Hello, this is Dr. Siddharth Dambar, expert in rheumatology and regenerative medicine, physician here at Chicago Arthritis and Regenerative Medicine. In this video, I'm going to talk about what are the qualifications, criteria, and experiences you want to find in your physician and clinic that would define them as a regenerative medicine expert, and thus be the sort of place you would like to go to for your regenerative medicine treatment if needed. First and foremost, why are we talking about this, right? And the reason why is because there's really big differences in terms of quality of care depending on the physician and clinic that you go to. The reality is that the difference between someone who is relatively new in a field and someone who has expertise and experience is a humongous gap. And the difference between a place that is doing something in a cookie cutter fashion versus a place that is doing it with nuance and expertise is the difference between getting a poor result or okay result versus getting a great result. So first and foremost, your physician should be a musculoskeletal expert. What that means is that if your physician is treating high blood pressure in one room, erectile dysfunction in another room, going to the emergency room to treat patients in a third room, in a third area, and then is coming to you to treat your knee or your back, that's not really a musculoskeletal expert. You want someone who's really focused in musculoskeletal and orthopedic issues. And with that said, you really want a physician to be doing your treatment as opposed to a mid-level physician assistant or nurse practitioner. There are bigger name groups and hospitals where they have really great physicians, but the ones who are doing the regenerative medicine treatments are not actually the physicians. It ends up being their physician assistant. The problem with that is, as a physician, our training and expertise when it comes to procedures is at a level and demand that is required if you want to get a great result. Number two is you want to be seeing a non-surgical musculoskeletal expert. So what I mean by that is orthopedic surgeons are very well trained in treating musculoskeletal problems and injuries and trauma with surgery. That's where the vast majority of their training comes in. As such, that nuances their thinking and approach to things based on what works from a surgical perspective. If you're looking for a non-surgical option, which is what regenerative medicine utilizes, needle-based procedures, utilizing your own cells to treat your arthritis, tendonitis, injuries, and back pain, then you want someone who's coming with a non-surgical focus and approach first and foremost. If you need surgery, see orthopedics, but if you want a non-surgical option, look for a non-surgical musculoskeletal expert. The next is when it comes to injections, every single injection has to be done under guidance, either ultrasound or X-ray guidance. That is the highest level of standard of care, and that's what I'd recommend. Plenty of my colleagues do regenerative medicine treatments where they're not using any significant image guidance or they're using very limited image guidance. The problem with that is if you're injecting steroids, because steroids are fat soluble, you don't really need to be very precise with where you're injecting it, meaning that you could be close to the joint, but you're not actually in the joint, but because it's fat soluble, you get some effect like that. But when you're injecting your own cells, your own platelets, your own bone marrow stem cells, you can't just be close to the right spot, you have to be exactly in the right spot. So if you're injecting a rotator cuff tear, it's not good enough to just be generally around the shoulder. You have to be in that tiny little area where the actual injury is. Sometimes that area can be 1 millimeter by 1 millimeter in size. If you're injecting blindly just by palpating the skin, your chance of hitting that is about as much as it is finding a needle in a haystack. On the other hand, if you're utilizing X-ray or ultrasound guidance, now you're very specific in where you're delivering those cells, and you can do it in a more precise manner, which will give you a better result as well. The next is your physician should understand really how inflammation helps you heal. So this is key because I think it's really misunderstood. As a rheumatologist, I see inflammation all the time in my patients. And the thing is that chronic inflammation is a problem. All right, chronic inflammation leads to a lot of damage and pain. The thing is that the way your body normally heals after an injury it utilizes inflammation. So take, for example, if you sprain your ankle, you have a swollen ankle. That is your body infiltrating the area with cells and growth factors to help start the normal healing process. So if you take an example of, let's say, a cut on your finger, what happens is you first have platelets that infiltrate the area. They stop the bleeding, of course, but then those same platelets then release growth factors, which then stimulate your local stem cells to start and coordinate a normal healing process. That healing process then requires bringing in other cells, which then release growth factors, and then through a slow process that first starts with inflammation, because that is how the body cleans up the area and then coordinates and starts the normal healing process, and then progressively starts layering in more tissue, remodeling tissue, and then eventually over time, actually healing the area. So acute inflammation is key, and that's important because when you're utilizing regenerative medicine treatment, you do get inflammation up front for the first couple of days. That's normal and healthy. For colleagues who don't quite understand that concept, they'll overutilize steroids in their injections. And that'll give some temporary pain relief. It'll reduce inflammation temporarily. It'll reduce chronic inflammation temporarily. But it's not a regenerative medicine treatment, and it's not going to give you a better outcome long term. So if your physician comes from the perspective of steroid injections first and foremost, and then if you failed all that, then consider regenerative medicine treatment, they're not really understanding how the body is better. You can better get the body to heal by utilizing regenerative medicine treatment up front rather than a steroid treatment. And a lot of my colleagues who work more from the interventional pain standpoint, they tend to focus a lot more on steroid injections. And again, the problem with that is it's not what's helpful for the body. The next component of this is you really should be getting a personalized treatment plan, a bespoke treatment plan, if you will, rather than a generic one-size-fits-all treatment plan. If you're going to a clinic where it's literally a factory, where every single patient gets treated the same exact treatment algo, that is not really what's right for you. What the reality is that your particular issues are going to be a little bit different than the next person. For example, you may have knee arthritis that's painful, but it's not just treating the joint. It's, well, what other soft tissue structures are injured? Is there a peripheral nerve that's injured? Is there a tendon that needs to be treated? Each one of those areas requires a slightly different platelet prep and a slightly different plan. So your treatment approach should be one that requires your physician to take a little bit of time to be nuanced and develop what needs to be done for you. And if you're getting a regenerative medicine treatment plan, they'll understand that they'll need to make multiple different preparations of cells that they're going to be treating you with, because that's how to personalize your treatment and treat each area that actually is problematic. The next concept that's very important for your physician to understand is prolotherapy. That's how you treat instability. So there's this concept in architecture called tensegrity. Tensegrity means that if you take a structure where the individual units are weak on their own, but when you put them closely together and compress them, you have an overall unit that's much stronger. In medicine or biology, that concept is called biotensegrity. And what that means is that the overall joint is stronger because of all the other structures that surround it. Prolotherapy is a treatment that's been around for decades, where by injecting certain types of solutions, whether it's dextrose or your own blood platelets, your own bone marrow stem cells, you can strengthen those surrounding soft tissue elements, which will then strengthen the overall joint. So important, because instability is a key part of what really drives degenerative arthritis, degenerative tendon issues, chronic back pain, instability. And when it comes to treating your joint or your musculoskeletal issue, the key is to not just treat the joint or the tendon that looks pathologic, but to treat all those other tissues that are supportive, that are adding more stability. So for example, let's say you have a knee pain issue. If your physician is only injecting cells into the knee joint, you'll get a partial benefit. To get a better benefit, you have to treat the other tissues around it, whether that's the ligaments, the tendons, the myofascial tissue, peripheral nerves, all those other tissues need to be treated. When you do that, you get a stronger overall structure, and that's what prolotherapy is. The next is, these treatments have been around for a while. I've personally been doing regenerative medicine treatment since 2008, But I have colleagues that have been doing this since 2005, and Philip Hernigue is a French surgeon that's been doing regenerative medicine treatments since the mid-1990s. And there's folks who've been doing prolotherapy that goes back even all the way to the 1950s. So regenerative medicine, it's not new, but the reality is that the understanding for why treatments work, how to optimize treatments, and how to get better results is really more aggressively being understood and discovered. When it comes to these kind of treatments, as a physician, we need to be very transparent regarding what are your potential candidacy for treatment, meaning how good of a candidate are you for treatment, and what are potential results that you can experience. A lot of that comes from just collecting data from your own patients. We do that here at Chicago Arthritis and Regenerative Medicine. That's a key part of how we track how our patients are doing, so that we can then tell patients, look, are you a good, fair, or poor candidate? And what does that mean in terms of getting a result? Are you likely to get on average, a 50% result, 70% result? Like, what does that mean? And how long can that result last? The reality is that each individual is a little bit different. Each situation is different. Each injury is different. And so you can never 100% say this is what's going to happen. But I think an understanding of your candidacy of a chance of getting a good result and what are the odds of that and what's an average result is important to understand when it comes to making a decision as to whether or not you should be getting treatment. If your physician doesn't really have a sense of that, they're probably not an expert in this field. And next is they should be following you long term. They should be following your results long term. If your physician is one who does a procedure and doesn't really follow up with you long term, that's not the person you want to be seeing. A physician's role is to be treating you completely, not just the procedure element, but everything that comes before and after that as well. Whether that is answering questions, whether that is guiding you through post-procedure care, or whether that is addressing, hey, are you doing well? Are you not doing well when you're months or years later after treatment, and helping to guide you in that process. So following your results long-term is key. And the last part of that is just guiding you through the process. I think the role of your physician is not to just do a technical job. It's really to guide you through this process in the same way that I would guide my own parents through this process or my own family through this process. That's the same sort of care and attention that you should be getting before your regenerative medicine treatment. So what does it take to be a regenerative medicine expert? It's a lot of different things. It's all those things that I just discussed. I think if you're looking for the best quality of care, those are the kind of things that you want to be looking for and you want to make sure are being highlighted. I think when it comes to figuring out the value of the care that you're receiving, it can be difficult to differentiate from one place or the other. I hope some of these concepts and principles give you something to rely on when you need to make that sort of judgment call. Thank you for your time. If we can be of additional assistance anytime, please contact us. And until we connect again, have a good day and live well. Bye-bye.